Bismillah ar-Rahman ar-Rahim. This is a clinical session about GIT history. In GIT history, we have to ask about age and sex and residency, and all of them was important in cases of GIT history because some disease occur more in some age. As celiac disease, it occurs usually at the end of the first year, usually when the patient starts to feed a solid diet that contains gluten, while cow milk protein allergy usually can occur in earlier age. Usually it may occur in 4, 5, 6 months of age. Also, sex is very important because some diseases have more occur in some sex, like autoimmune disease, which is occur more in female patients. Also, we have to ask about the residency of patients because some disease occur more in some area of more than the other area. Also, we have to ask about the onset of symptom, when to start, because may give us a clue to the diagnosis. When the patient have a chronic diarrhea at the age of 2 years, it may be the onset that start at the end of the first year, may give us a clue that the case it may be celiac disease. So the onset of the disease is very important. Also, the onset of symptom may give us the duration of the illness, that is may give us also clue about the chronicity of the disease. When patient, we have to ask about diarrhea, which should include the consistency of a stool and the frequency, which is very important. And also we have to ask about the duration to decide that this is a case of acute diarrhea or chronic diarrhea, because acute diarrhea with a duration less than 2 weeks, while chronic diarrhea with duration more than 2 weeks. There is another associated factor in relation to diarrhea. We have a focus history about diarrhea after I finishing the GIT history. Then we have to ask about if there is any constipation. Also, we have to ask, very important, the consistency of the stool. Is there any pain? Because fissure may cause constipation. Is there any streak of blood in the stool that may be related to the constipation? Due to hard stool may cause fissure. Is the stool, which is due to constipation, is this bulky stool, pellet-like, مثل البعور يسموه? All these we can ask about it regarding the constipation. Now for the vomiting. For the vomiting, we have to ask about frequency, relation of the vomiting to feeding. Is it immediately after feeding? It takes time after feeding, because immediately after feeding it may be related to esophageal problem, while delay it may be related to other problem. Also, we have to ask about the content of vomiting. We have to ask about the odor of the vomiting, if there is any blood in the vomiters, the color, is it bilious color, which may indicate the site of a problem in the GIT. All these should ask about the vomit. There is a lot of questions related to vomiting. We talk about it at in relation to some cases, but now we just to be mentioned that point about vomiting. Also, we may have to ask about, in relation to vomiting, about any symptom of dehydration may be caused by vomiting. Any losing weight, which is very important. Also, we have to ask about abdominal pain, if it is present. The abdominal pain is very important, especially in older children, because we have to ask about the site of the pain that may indicate the origin of pathology of pain, Is it epigastric, right hypochondrial, left hypochondrial, low in pain? All these may indicate the site of the pathology. Like epigastric pain may indicate a duodenal or gastric origin, or it may be gallbladder or liver origin. While low in pain may indicate a renal problem. While lower abdominal pain, it may be related to the appendix, colonic problem, or maybe related to bladder problem. All these we have to ask about pain. So the site was very important regarding the pain. Also radiation. Radiation of the pain also may give us a clue to the origin of the problem. Sometimes pneumonia may cause an abdominal pain. So this is a radiation pain. Also pancreatic pain may give us back pain. So we have to ask about radiation. Also we have to ask about the character of the pain. Is it related to sleep? It is awake the patient from sleep. Also we have to ask about the relation to the food, which, as you know, duodenal ulcer may be related to fasting, while gastric ulcer may be related to feeding. Also, we have an abdominal distension. Is it acute or chronic distension, which may be due to any abdominal distension? We should think of ascites, mass, hepatosplenomegaly, or gaseous distension in cases of malabsorption, and acute abdominal distension with vomiting and constipation. It may be related to intestinal obstruction. Is it associated with fever, weight loss? That may be related to malignancy and mass. So all these very important related to distension. If there is any GIT bleeding, now we ask about GIT bleeding. Is it upper GI bleeding or lower GIT bleeding? Upper GI bleeding usually presents with hematemesis, either copy ground vomitus or frank red blood or clot of blood. While lower GI bleeding usually presents with frank red blood in the stool. So upper GI bleeding, in addition to vomiting of blood, it may be also associated with a black tarry stool, or what is called melena. This is all indicate upper GI bleeding, while lower GI bleeding is associated with fresh red blood, which here, if it is present, we might ask about, is it painful or painless? Regarding the lower GI bleeding, also, is it associated with diarrhea or not? All these was very important. While the upper GI bleeding, we have to ask any associated with taking any medication like non-steroidal anti-inflammatory disease. Also we have to ask if it is associated with any abdominal pain like peptic ulcer, or we can ask if there is any severe illness, because stress ulcer that can cause copic ground vomitus, usually associated with severe shock, severe sepsis, severe burn, and so on. So regarding the upper GI bleeding, we have to ask about these points, if there is any bleeding, any pain, type of bleeding, is a clot, fresh red blood, copic ground vomitus, any history of taking a drug, Also, we have to ask about if there is any bleeding from the other side of the body, if there is any ecchymosis, purpura, urinary bleeding, because the cause it may be bleeding tendency. Jaundice, which is mean yellowish discoloration of the skin and sclera. If it is present, we have to ask about any associated bleeding, ascites, edema, fever, abdominal pain, vomiting. All these may be related to the jaundice, and there is a lot of precaution. We mention it at its time. Weight loss, which is very important, which indicate it is a real pathological disease. Failure to thrive or failure to gaining weight. Anorexia or loss of appetite, which is very important also, it may indicate severe disease. Fever, which is very important here. Any disease in the body, we should ask about fever, because sometimes infection or sometimes immune disease may cause, or malignancy may cause fever. Now, is the symptom related to special situation? Maybe some symptom may occur in the school. So it may be not a real symptom, it is because of phobia or sometimes because of psychological problem in the school. Or symptom may be related to special food, that is occur due to some food allergy, or symptom related to special drug, because like an ulcer, patient may develop GI bleeding after taking this drug, like non-steroidal anti-inflammatory drug. Now, antenatal history in GIT is very important in some situations, as in some cases polyhydramnios that may be associated with congenital GIT problem. Delay in passage meconium, which may be associated with cystic fibrosis that may be associated with the chronic diarrhea and a chronic chest infection. Early neonatal problem, any surgery in the early neonatal problem, and any delay in passage meconium, all these may be related to some of the disease. Feeding history is very important in cases of GIT problem, especially in infancy. We have to ask about type of feeding, bottle or breastfeeding. If it is bottle, we have to ask about the sterilization, especially in cases of acute diarrhea, which is usually due to infection of gastrointestinal tract. Also, any change in the type of food, as in celiac disease, cow milk protein allergy, and so on. Medication use, as in case of laxative dependent, as a clue to Hirschsprung disease or another organic causes of constipation, if there is history of laxative dependence. Family history, as we know, in family history we have to ask about consanguinity and degree of consanguinity, and any GIT disease or related disease in the family. Related disease in the family, because a lot of disease in the family is familial disease. So cystic fibrosis, familial disease, and there is a lot of inherited disease. Also related disease, like a patient when present to you with autoimmune disease like autoimmune hepatitis, we can ask about other autoimmune disease in other family member. Early neonatal death is very important, because some disease in GIT may cause early neonatal death. School attendance and performance. School attendance, it may need the disease affects the patient activity, so the attendance of school will be decreased, so it is a real disease, or a performance because disease is severe, so affect the performance or affect the psychological or neurological activity or function of the patient. Development was very important because chronic disease may affect the development of patient. In female adolescent, ask about menstrual history, which is very important because sometimes abdominal pain due to menstruation may occur. Social history is very important because some of the infectious disease in a small house, overcrowded house, may transmit it easily. Also, we have to ask about water supply, presence of animal, because some of the disease was transmitted because of the presence of animal. Vaccination important in some disease, as in diarrhea due to rotavirus. We can see if the patient taking vaccine rotavirus, if the patient have jaundice or liver disease, and we think of viral hepatitis, especially B, we can ask about taking history of vaccination, especially vaccination to hepatitis B. And thank you. Now we talk about focus history in acute diarrhea, which is very important and commonly seen in our practice, and we are commonly facing such a problem when you are coming a doctor. So what is the important point regarding focus history in acute diarrhea? As I mentioned, age and sex, which is very important, and the duration. Duration, because less than 2 weeks indicate acute diarrhea. Now we have to ask about the frequency, how many times he pass motion, and the amount. The amount, is it small amount, large amount? That may give us a clue to the severity. And when the mother told you that the stool is coming out of his diaper, it may indicate a large amount. And consistency of a stool. Is it watery or loose stool? Watery, which may be associated more with dehydration. Loose stool, it is soft stool, it is not watery. And watery stool, usually it is associated with viral gastroenteritis, some of the bacterial, and also it is occur with Vibrio cholera, that is the most severest type of diarrhea that may cause shock with just passing of one motion of a stool. The patient may pass to the shock and severe dehydration. Also, we have to ask about a blood in the stool and the mucus, and is it streak of a blood or mixed with the stool? And this presence of diarrhea and the blood and the mucus in the stool, it may indicate usually colonic invasion, and is usually occur in cases of colitis, like in anti-amoeba histolytica, shigellosis, and so on. But in a chronic case, this is an acute case, but in a chronic case we should think of inflammatory bowel disease. Is the case associated with vomiting or not? Most of the cases of acute gastroenteritis is associated with vomiting. Is there any abdominal pain, colic, and tenesmus? And usually the colic and tenesmus, usually it is occur with colonic infection like Shigella, Salmonella, and mostly with Shigella and anti-amoeba histolytica. Now, abdominal distension. In cases of diarrhea with abdominal distension, especially acute diarrhea, we are afraid from cases of hypokalemia that may cause paralytic areas, that may cause distension of the abdomen. Any associated fever, and is it high grade fever or low grade fever? And usually in cases of high grade fever, usually it is occur in cases of bacterial gastroenteritis like salmonella, shigella, while low grade fever usually associated with viral gastroenteritis like in cases of rotavirus. Now, activity, lethargy, irritability, or restlessness, this is very important point, because it is first, it gives us a clue about the associated dehydration, if it is present, is it mild, moderate, severe? Also, if it is associated with severe infection. Also, we have to ask about oral feeding, if it's oral feeding as well, and weight, is it decreased or normal? This is very important. When the mother noticed obvious weight loss, this may indicate dehydration, especially if the mother knows the previous age and the current age. Now we have also to ask about thirst. What is important about thirst? Because thirst is very important in relation to dehydration. So when there is patient is in no thirst, or drinking a lot of water. When drinking a lot of water, it may indicate a moderate to severe dehydration. Urine output is very important in assessing the state of hydration. When there is normal urine output, the patient may not develop dehydration or may have mild dehydration, while patient with decreased urine output, it may have moderate to severe dehydration. Any associated urinary tract infection symptom like painful micturition, abnormal odor, frequency, because usually there is another cause of acute diarrhea other than gastroenteritis and all the infection due to gastroenteritis. You have UTI and pneumonia and meningitis and otitis media. All these infections may cause diarrhea, especially in the first year of life. This is what is called parenteral diarrhea. So we have to ask about any symptom associated to urinary tract infection. Also, we have to ask about any associated respiratory tract symptom. Any shortness of breath, any dyspnea, any tachypnea, any cough, because some viral illness may cause GIT and respiratory symptom. Also, as I said, parenteral diarrhea, pneumonia also may cause diarrhea in infancy. Also, severe increase in respiratory rate, it may be associated with acidosis in cases of acute diarrhea with dehydration that may lead to acidosis, so it may cause increase in respiratory rate. Also, we have to ask about any abnormal body movement or fits, because convulsion may associated with diarrhea. Why? It may be the case of diarrhea due to meningitis that can cause parenteral diarrhea, so may cause fit and diarrhea, or it may be some cases of shigellosis that may be associated with diarrhea and bloody diarrhea and high fever. It may be associated with fit. Shigellosis per se can cause fit, and sometimes can cause diarrhea, and sometimes can cause fit. Also, if the patient develops electrolyte disturbance, and the most important electrolyte disturbance that can cause fit or abnormal body movement, was hyponatremia and hypernatremia. Hyponatremia and hypernatremia. All these may be related to fit in cases of diarrhea. The skin rash, you have to ask about the skin rash, especially in the perianal area, because the frequent napping of the patient may cause rash and contact dermatitis. Now, type of feeding, bottle or breastfeeding, is very important here. Type of feeding was very important here. Is it bottle or breastfeeding? Usually, bottle feeding have more development of diarrhea because of more risk of infection and getting the gastroenteritis more than breastfeeding. Also, bottle feeding may cause cow milk protein allergy more than breastfeeding. In rare situation, breastfeeding also may be associated with cow milk protein allergy. If the patient taking bottle feeding, we have to ask precisely about the way of sterilization. Is it the proper way of sterilization? So we have to ask about timing of boiling, how many bottles she has, and so on. Any history of a drug intake, a lot of a drug intake, especially antibiotic, already may causing diarrhea. Family history was very important because if the patient, if there is another member in the patient also develop diarrhea, it may take the infection to the other member of the family, so that our patient may get the infection from other member in the family. So overcrowding in the social history is also important because of transmission of the infection from patient to patient. We have to ask about sewage system and water supply, because all of these, it may increase risk of infection, the presence of animal, and so on. Travel to endemic area, that these endemic area with disease that can cause acute diarrhea also was very important. So all these important points when we're asking about a case with acute diarrhea. And thank you.